One thing the pandemic has done for many of us is remind us about just how fragile life can be. If you found out today that you or a family member had a life-threatening illness, would you be prepared to make a quick health care decision? Dr. Brent Wallis from People's Health is here to join us and explain the process of what's called advanced care planning and why it's important. Good morning, Dr. B.
Good morning. How are you doing?
Doing all right. Getting ready for this Easter weekend, and maybe this is a time when we're going to be spending it with family, and not a bad time to be thinking about being prepared for what the future may bring. What does it mean to plan for care in advance?
Sure. That's a very good point. If you are with family this weekend, it could be an opportunity to have a difficult discussion with them. So, advanced care planning is really just it's a way to retain control over your own health care and to ensure that you get the care that you want. And, we don't like to think about it, but at any time a serious or really life-threatening illness or accident could happen and could leave you unable to communicate or make your own decisions about the care that you want to receive or to share those wishes with your family. So advanced care planning actually helps you kind of map out what you want and what you don't want in advance, long before you get sick or have an accident. And then your doctors and your family have a roadmap that they can follow.
So anyone can do this at any time, but no one's required to do this, huh?
No, you're definitely not required to, but it really is important that you think about it and that you talk to your parents about it. Even if you're in good health, it's really never too early to make, your wishes or your desires known to other people. There's no rule that says you absolutely have to do it. There's no law, but the state and federal laws do require that healthcare institutions and physicians like myself respect the wishes of any patient over the age of 18, regarding their medical care and what they want.
You say over the age of 18. That sounds awfully young to be doing this. Is there some age at which you should do it, or is this only for older people?
No, it's really not, and I think that's a misconception. A lot of people don't think about advanced care planning until they do get older and have a lot of chronic illnesses. But you can really be any age when you start to think about this. You could have an unexpected medical condition pop up. Like I said, you could get into some sort of accident. And so even young people should start to think about it, and try to kind of lay out the steps that they want people to take for their care, long in advance before you actually need it. That's really the only way to be prepared.
And this isn't only so you make sure your wishes get carried out, but it also can take a lot of pressure off your family members if, God forbid, you end up in this situation, right?
Times when there is some sort of crisis or medical emergency, family members have to be called in and they're asked to make decisions, for their loved one. And that can be very difficult for them. Family members, have a lot of ideas. They have a lot of feelings about people in their family. And so they may make decisions that are really based on their beliefs and not necessarily yours. Another thing to keep in mind is in larger families, sometimes there's really opposing beliefs. And so you don't want to set up a situation where your family members are arguing with each other about what you want. So what the advanced directives really do is they help your family know what you specifically want that you laid out for them to enact when you have a problem. And so it takes away that burden of a really tough decision for them. It really represents you and your wishes. So, I tell everybody don't get caught unprepared. You never know what's going to happen. It's always a good time to have this important but sometimes difficult discussion with your family so they can be prepared as well.
We're talking with Dr. Brent Wallis, Dr. B from People's Health, about advanced care planning. He talked there about advanced directives. What are those? And how do you consider what you want for your own advanced directives? We'll pick it up there after we come back here on WWL as we check in on WWL traffic. Dave Cohen in for Tommy Tucker. Dr. Brent Wallis, Dr. B from People's Health, is talking to us about advanced care planning. As we get together with friends and family over Easter weekend, not a bad time to talk to your parents and your children about what you want for your medical care in the event that you need it. Dr. B, you were talking about advanced directives before the break. What are those?
Sure. So advanced directives are really just documents that you complete as a part of the advanced care planning process. And they're exactly what they sound like. They're written instructions. In particular, it's really two different documents that people complete. One is called a living will, and the living will is actually, it just really outlines instructions for the treatment that you either want or you don't want, so that you can give those instructions to your physician or to healthcare workers that are caring for you, maybe in a hospital-type setting. And then the second document is actually called a power of attorney, often a healthcare power of attorney, and that really identifies the individual that will make those decisions for you when you can't make those decisions for yourself. And the person you designate can be anyone. It doesn't have to be a family member or a spouse. It can actually be a friend or really anyone that you trust to actually uphold the wishes that you have. So those two forms really make up the advanced directive. There can be some other forms and instructions that are included in it, but it's really just that simple. So the advanced directives, like I said, are really just an important guide for your doctors and your family and that power of attorney that you've designated to make those decisions for you when you can't, and they play a huge important role in working with your doctors on your care when you can't make those decisions.
So we talked about having these conversations. Now we've talked about filling out paperwork so it's actually there in writing. How do you get this whole process started of formalizing all of this?
Well, one of the best things you can do is actually talk to your primary care physician. All PCPs have these sort of discussions every day with their patients. Sometimes they prompt those discussions with their patients if they don't bring them up to us. But that way you can kind of learn about what your options are. If you're worried about the discussion, it is a difficult discussion. I always tell people to write down a list of questions to ask so that you don't forget, and that kind of helps you in that discussion with your doctor. To form the conversation and make some thoughtful choices. You don't have to have all the answers at all, and you definitely want to include your family members in those discussions and your friends in those discussions. So, a couple of things to think about. Who do you want to make those healthcare decisions for you if something happens? And then another big one is the type of treatment that you really want, but also the type of treatment that you don't want. And that could include things like resuscitation or other life-saving measures. And then how comfortable do you want to be? How do you want your pain managed in particular? And, do you want procedures done as well? Do you, if you can't eat on your own, do you want someone to feed you or put a tube, in you so that they can feed you? So then you really, you create the advanced directives, you actually write them down and share them with your doctors and your family and your friends, and you can even share them with your PCP or your health plan. Whenever someone provides those advanced directives to us, we actually make them available to all of the physicians that are caring for you, so they've got access to those advanced directives and your wishes if they need them.
These are all things that I think are difficult decisions to have, difficult decisions to make. But I think you made a great point earlier that it takes so much stress off of a already way too stressful situation if you've thought these things through and everyone's on the same page.
Yeah, if you really want what you think is best for you and you want to support and help your family and friends, it's important for you to outline these things. And like you said, it's a very difficult conversation. I know my parents didn't want to have it. I kind of had to press the issue a little bit with them, but it's an important one to have. And we have, there's a lot of resources on the web that have good information. We set up one at our website, peopleshealth.com, Advanced Care Planning. There's also another one that's actually called the conversationproject.org. that has a lot of great resources where you can really kind of form your ideas and that discussion so you can start this conversation with your doctor.
Dr. B, thank you so much for joining us. I think this weekend would be a great time for people to have those discussions. I know my mom actually started the conversation with me about what she wants and handed me the envelope and said, here, we need to go over this together. And it was actually, in the end, very settling and comforting that I knew what she wanted so that, God forbid, if it happens, and eventually we know that we're going to have, life does come to an end for all of us, that at least I know what she wants and I can make sure that her wishes are carried out. Have a great weekend. We look forward to talking to you again next week.
Thanks, Dave. You too.
Dr. Brent Wallis here on WWL. You can find out more information at peopleshealth.com/radio. You can call 1-866-687-7335. You can also follow People's Health on Facebook, Twitter, and Instagram. I'm Dave.